Bill de Blasio has appointed a chief equity officer for the city's Test and Trace Corps. She will work to fight disparities in communities most impacted by COVID-19. Her name is Annabel Palma. She's chief equity officer of the COVID-19 Test and Trace Corps. She joins us now. Good morning. Thank you for being with us today.
Good morning, Betty.
I want to talk to you about the program, but first of all, I want to talk to you about something a lot of people have noted in watching these protests. Is there a worry on your part that because people are peacefully, somewhat not peacefully, joining together in protest, that this could possibly spread the coronavirus even more so?
Absolutely. There's always, in the times that we're living, we've been asking individuals to try their best to stay safe and keep each other healthy. And so when you see big assemblies of individuals, as you've seen this past weekend, there's always a concern that the spread of the virus can get worse.
So is there a way to peacefully protest and kind of protect yourself as best possible?
Absolutely. You can, you can do the demonstrations, you can protest, but again, you should take all precautions to keep yourself and other New Yorkers healthy.
Okay, let's talk about this program because you are the chief equity officer of the COVID-19 Test and Tracing Corps. What does that mean?
Sure.
What are you doing? What's this role?
So the role is basically to be a voice, a connector for the communities that have been the hardest hit. For New York City as a whole, to ensure that there is equitable distribution of resources to fight this pandemic. And so my goal and my mission is to bring individuals together to work with local elected leaders, with faith leaders, with community-based organizations who are on the ground, who know their communities best, to ensure that the test, trace, and Take Care Home program is successful at keeping New Yorkers safe and healthy.
Some of the folks who are most vulnerable are also worried about their immigration status. Therefore, they may not step up to get the testing or don't even know that testing is available to them. So how are you helping in that area?
And you're absolutely correct. And before this pandemic, it was hard to get individuals to seek healthcare, to seek certain services, because they were afraid of their immigration status. And I'm here to ensure those individuals, to ensure those communities, to ensure all those groups that we're not interested in immigration status, that we're not interested in any information that can that will prevent them from coming forward. We're here to get folks tested, to ensure that we know who they've come in contact with, and then to provide a Take Care at Home program to get them healthy again. And so no one should be afraid to come forward because of immigration status. We're not asking anyone what the immigration status is. We're not interested in it. We're simply interested in people being healthy and people being safe.
Absolutely. So you are a longtime Bronx resident. I want to get your reaction to the information that the Bronx has the highest number of COVID-19 cases and they are twice as likely to die. Why is that?
For many years, we speak about inequalities, we speak about disparities, and being born and raised in the Bronx, there are many challenges of, individuals don't have enough income, individuals struggle with housing options, and so folks don't have access to quality health care, and so these issues all play into the numbers that we're seeing with this pandemic. And so I'm here to again ensure that there's equity when it comes to promoting and rolling out this program, that individuals in the Bronx will get the quality healthcare that they need to fight back this pandemic.
It is an important message that absolutely 100% needs to be heard. We thank you, Annabel, for your time and the important work that you're doing to, in fact, save lives out there. So thank you.
Thank you so much.